We set about undertaking this study because we recognised there was an unmet need. And when I say we recognised, I mean me as a practicing nephrologist, but also patients that I'm seeing in clinic. Although a lot of patients that are coming to my clinic absolutely need to see me for clinical assessment and revision of their medication, for example, there's often occasions when patients are coming to clinic simply for routine assessments of their kidney function. Now, this is necessary and justified. It's important that they have these tests done, but they themselves are otherwise well and they don't otherwise need to see me on that particular day. And so in certain circumstances, patients need their kidney function checking, but they don't otherwise need to come to a clinic for those tests. We recognised that if we could have a facility that enabled patients who were otherwise well to self-check their own kidney function at home, then this would be beneficial both to patients and also to healthcare resources.
On one of my regular visits to see Dr. Murray, he mentioned he was quite excited about a new study about self-testing at home. What we had to do was we were given the kit at home. We had to keep it plugged in, and it was a handheld device. And then we had to do the blood test at home, the capillary one. We had to log down the results from the machine, and then we would go into the clinic an hour or so later and do the same thing again to see if both the bloods matched. And the same with the urine. Well, the DIP-IO kit consisted of 3 things. It was the cup, the dipstick, and the colour board. So you did your sample in the cup, obviously. You dipped the dipstick in the urine, and then you put it on the colour board, and then you scanned it with your iPhone, took the photo, and from there the results automatically went straight to the hospital. It was a brilliant study. It was simple to do, but it has potential to have great benefits.
Well, we had in our study group a patient advisor, David, who had a background in working in pharmaceuticals, so he was familiar with some of the processes that we were looking at, and he had a passion and an interest to move this forwards. And so we were very keen to incorporate him from the outset in terms of talking about what he understood from his perspective as a kidney transplant recipient, but also about what he understood about devices and healthcare processes. And so he was instrumental in terms of setting up the study design along with our other partners and stakeholders.
You know, I did get visibility of all the frustrations of gaining, you know, the funding and approval and you know, all the competition that's around the NHS to get funding for any project at all. As the funding came in and everything was organised, it was getting involved in some of the you know, reviewing the protocols for how the study was going to be run. So again, for me that was very interesting, but also I think having had a transplant, and it's quite a small thing I suppose, but it's kind of at least giving something back to the people that have helped me get through the whole process. Having to use the devices that we were using, there's always a desire to understand how they work, but also a slight nervousness in terms of the fact you've got to take blood and you've got to do all this sort of stuff, and is it going to work, is it not going to work? So having an input into how the patients were instructed and trained, I think was very valuable as well. The team are looking at making quite a lot of improvements to the type of device, how the device works and how the device is used. So, you know, I think that involvement of the patients has been absolutely critical.
So what we've been doing more recently with the Academic Health Science Network North East and North Cumbria and the CRN for this region is to look for other companies that may be wishing to help us design a more user-friendly device that will still obtain the relevant results in an accurate and safe way, but may be easier for unselected patients to use in a wider variety of clinical situations.
It was more convenience that you could do it really when you wanted to, when you felt as though you were comfortable doing it and relaxed in your own home. So there was no pressure to get to the hospital to do it at a particular time. It can be very relaxing, or would have been very relaxing to do it, and it would have saved us such a lot of time and hassle and freed up time in the clinic.
It's really interesting to see how this journey has evolved and where we think it can go in the future. You know, I do think genuinely that there is an unmet need that we can deliver, and this has been a big step forwards.